Hello, sir. I'm Brittany, and this is Megan. We're your nurses. We're going to be looking after you today. I hear you're not feeling very good.
Brittany and Megan are fourth-year nursing students. Their patient today is one of the Sims at UBC Okanagan. His name is Parker. Pediatric simulation is a crucial part of the nursing program on campus, as caring for children often comes with unique challenges.
Oh, I know it's not great, but it'll be over really quickly, okay?
The way kids communicate their feelings or need to receive information can be quite different from adults. Working with a sim gives nursing students an opportunity to learn how to care for and talk to kids in an often complicated and at times very emotional setting.
A lot of our students are young and they may be coming right out of high school and they haven't had that interaction. They come into this scenario and they're talking to them like an adult, and then all of a sudden, just a couple prompts later, they figure it out. Oh yeah, okay, this is a kid and I have to think about my theory that I learned in class, and now I'm pulling that into the clinical simulation.
Here's your mask, buddy. Do you watch Batman? It's like a Batman mask.
You really realize what kind of language you use when you're talking to a child or to Parker, because you need to make a 6-year-old understand what you're about to do, and then for them to be comfortable with it.
Parker in any other simulation has been great. We tend to focus, especially with pediatrics, on the acute situations that occur that we may not exactly have the experience when we go in for a couple weeks on the pediatric ward. So it really provides us with the knowledge and the necessity of what we need to do in these kind of acute situations.
Okay, yeah, I really don't feel good.
From a small room separated by a window, an instructor presents what is ailing Parker.
Did it happen immediately after the cookie, or did it take a little bit?
Parker is usually 6. He can be younger or a bit older. Sometimes he comes in having a hard time breathing after soccer practice. Today, though, he has eaten a cookie that contained nuts, and he's having an allergic reaction.
A lot of us who operate the Sims are moms or have quite a lot of pediatric experience, and so we prompt them through his voice a lot.
Once you get talking, you work as a team. There's always a group of us in here doing the simulations, and you really get in the flow, and it's a lot easier once you get started.
Oh, hurts a whole lot, hey?
Really hard to breathe.
Well, we're just gonna try and get something for you, okay? His oxygen's set at 2 liters right now on nasal prongs.
These simulations have given us the opportunities to learn a little bit more about the area because we don't get a ton of experience on the pediatric floor. So this has really helped, I think, some students decide where they want to go.
Recent research done out of the US has shown that simulation is just as good as clinical time.
Parker can simulate lifelike behaviors such as lung and heart sounds, and with that, verbal responses designed to help these future nurses learn the art of communicating with a child can take place. From Kelowna for Shaw, I'm Tammy Williams.